Hello, everybody. Happy Friday. Good morning. Today we're here to talk about testosterone for women, a very important topic that you may or may not be seeing a lot of all over your Instagram feed these days. We want to get all your questions answered. So today I have an awesome panel with me. Quick on me, I'm Katie, founder of Joy. I started Joy 3 years ago because I really wanted to provide education and access on therapies that have been life-changing for me. Today we have Dr. Melissa Loseke. She is Joy's medical director. She's been practicing and treating women for 15 years. She's got a clinic in Omaha, Nebraska, my home state, and she's also an educator, trainer, speaker. So thank you for joining us, Melissa.
You, as always, thanks for having me.
And then we also have my friend Meredith. I believe we met a little bit over a year ago just on a Zoom call, with other women talking about women's health and maybe an event. But I remember Meredith sharing a really vulnerable story about how she had an upcoming surgery scheduled and she felt a little bit unprepared for that. And so that's kind of how we got connected. And Meredith, I would love you just to kind of share your story and your experience and just say hi to everybody.
Well, thank you for having me. This has been life-changing for me, and I don't say that lightly at all. And it was probably maybe it was well, November. I have been on testosterone for 1 year,
Yeah.
November.
Yay.
So we met a couple of months prior to that to get the whole thing going, and I had my right ovary removed in January, and the doctor was refusing to do a hormone panel, even though he was going to take my ovary and I would only have one ovary left. And that was after a partial hysterectomy and literally just having like pretty much no parts and pieces left. And so when I told you that story, you were like, no, 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 you need to get your hormones tested. On top of that, I was having crying spells, hot flashes, cold flashes, skin changes, hair changes. I mean, you name it. My body was out of control. My brain was out of control. I had no energy and nobody was listening. And I felt insane. And that no matter what I would say when I went into a doctor's office, they would pass it on as you have a high stress job, you have three teenagers, of course you're fatigued, of course you're tired. Get a hobby was probably the biggest piece of advice I got was get a hobby. And I didn't say the things that I wanted to say to these people, but I thought them and then I would say them on the internet. But it was such a game changer when I got my panel back and realized that my body was making pretty much zero testosterone. And I wonder how long I had been doing that because from the beginning I had issues with my reproductive health. So I think that probably from day one I was almost no testosterone. And when I tell you it has changed my life, it has given me a new lease on life at 44 and there's no going back.
Amazing. Wow, that is a story. I'm so glad I found you because you're also just like a wonderful, person to, spread your story. You're a comedian, speaker, and you're an entrepreneur. I absolutely love the company that you've created for laundry. I'm using your all your laundry detergent and also excited about aren't you launching some dish stuff too or
I know
no?
it's so
No, you're
exciting.
not.
Yes.
Are you? I don't know.
Yes.
I don't want
Yes.
to say
So
it.
the we have dishwasher detergent sheets that are coming out that are just like our laundry detergent sheets. So there's zero microplastics. They are vegan, cruelty free, completely biodegradable. The packaging is completely recyclable. It is all plant based. It is absolutely good for you, good for the planet. It is better for your clothing and your skin. And it's just wonderful. And it was a 2 year process to get the laundry lady out to the public. And we launched in April and sold out within 36 hours. And then panicked because I had no idea what I was doing. And we had just sold out all of our inventory. And so now, and I was packing all of that in my living room. So that got a little overwhelming. So we officially have now started shipping everything out of our warehouse in Michigan. And the dishwasher detergent sheets are going to be landing in Michigan this month.
Oh,
So they
yay.
will be up, and we do have a limit. We have realized that we have to say we have a limited quantity because people are becoming recurring subscribers to get them monthly or bi-monthly or whatever. And we've realized with the demand, we can't sell out again. We're learning lessons on the fly here, but I looked at my husband, and when I saw how many we ordered, I said, there's no way we're going to sell out again. You have to make the reorder. And he's like, I've already made the second reorder. Don't worry. And I was like, okay. But it's a panic to, kind of be thrust into that. Obviously good problems to have, but you don't want to upset customers. And this one is a game. I mean, I love my detergent sheets, but like I've always hated the goos and the pods and the little like cascade rocks that you stick in there because they always leave that film and gunk and gross stuff. And you're always wondering, what am I eating? Because
Yeah.
it's on the plates.
Yeah.
And
Well,
so this now
it
is,
literally does affect your hormones, right?
oh yeah, I mean, it has
Oh,
to,
yeah.
right? I mean,
They're endocrine disruptors.
Yeah.
So anything endocrine related.
so this
Amazing.
was a big thing for me. I oddly have a weird love of laundry, but I knew that I wanted to put something positive back into people's homes and not be something that was detracting and something that would add value instead of take away. And so it took me a really long time, but I do
Yeah.
think that those are, I have high hopes because I think that we can be a disruptor. So instead of disrupting your hormones, we want to disrupt the market and say, hey, make the switch. And so our tagline has sort of become join the green laundry revolution. Like we can do this together. And so it's exciting, but
Yeah.
yeah,
Well,
I
congratulations.
thank
Thank
you.
you. Thank you for being here and for sharing. And yeah, it's really important. I would say let's maybe get into, talking about answering some questions on testosterone and see what everybody has. If you're ready, Melissa.
Oh, yep. Let's do it.
I think one important thing from Shannon's asking about, this is such a good one. Does it stop your body from producing naturally?
If your testosterone's already at 3, you're already not making it. So it's a common question with guys too. So 95% of a female's testosterone production comes from her ovaries. The other 5% is coming from her adrenals. I am of the opposite opinion. You'll hear people sometimes say, well, when you go through menopause and that ovarian function ceases, your adrenals will pick up the slack. They're not going to pick up 95% of the slack. And your adrenals are also where cortisol comes from, which is your stress hormone. So no. I always think, here's how I tell everybody to think of testosterone. If your vitamin D was low, you would go to Walgreens, pick up or a better place with a higher quality supplement, pick up your supplement and take it and not think twice to replace those levels naturally. Testosterone is the same way, just as of right now, it's considered a controlled substance that you have to get from a provider. And honestly, you're probably going to want a provider because it even there's so the hesitation you'll hear from me is there's a big push to get testosterone non-controlled to make it more readily available, but you still are going to need some support to know, well, what do I do if I'm too high? What do I do if I'm too low? Where's my sweet spot? How do I manage it? So it's still great to have that guide behind it.
Yeah, yeah. Well, speaking of levels, I think everyone always wants to know what's the level, what's the level. And I don't know, Meredith, how long it took to dial in your levels, but it takes some time, right? But
Well, what I will say to piggyback off of the doctor is it kind of made my brain jump when you were like, if we made this not a controlled substance, I would be like, whoa. Like, first of all, what I can tell you from my experience is that I'm a huge fan of getting my blood work done every 3 months so we can see exactly where it is so that I know a professional is checking on me to make sure that I have not over or under or this or that. And there have been fluctuations, right?
Yes.
So I was at like 167 and then my next blood draw I was down to 143 or something, but it was still in a great range. And so what I started to do, because I noticed if I took my full dose on Sunday, by Thursday I was feeling
Breaking
a little tired.
symptoms. Yeah.
So I got with my health coach and I had a message sent to the physician and I asked, can I split it? And the answer was absolutely. And so I do a half on Sunday and then the half on Thursday, or, whatever the days are. And it's actually kept me way more even and feeling, that I'm right where I need to be. But, I would not want to be taking any of these things without being underneath a physician's guidance and watchful eye, because I have no idea what I'm looking at. So that would freak me out.
I tend to share that sentiment. Like, I understand why they're trying to do it. And I think the bigger goal is, how do we get it to be an approved substance for females?
Yes.
Guys can get testosterone. We have it. We need it just like they do, but yet it's considered non-FDA approved for us, which also means then insurances don't want to cover it. So we as females have to pay cash to feel great.
Yep.
So, and I'm with you. Like, I still think it needs to be managed 100%, but let's make it readily available for females.
Oh, yes, absolutely. It has changed my life. I would love for insurance to pick up the bill, because why shouldn't they? I mean, especially for what we spend on insurance.
Right.
Which is outrageous. So I agree with you there completely. And I don't think it's fair. It feels like that pink tax, right? Because it's like, why should men have access to it in the way that they do, and women, there was some documentary that, yes, you can sit at your desk. My husband is texting me. We both work from home. That's Laundry Daddy. And I'm
Laundry Daddy.
So, but I agree with you completely, because it feels like that. It's like, you got to pay to feel better. Whereas, like the documentary I was watching talking about Viagra. Viagra is a blood pressure pill. Well, they found it has a great use in another capacity.
Yep. In the studies, the guys didn't want to get off of it, even though it didn't do anything for their blood pressure. They're like, yeah, you can't have this back. I've got erections and you cannot take it.
Right. So I agree with you completely.
So circle back to Katie's question. Normal, what's normal? I hate the term normal. I go for optimal. Again, another hotly debated topic. Most of the labs have normal values. And oftentimes for us females, they shrink that normal as we age. So a lot of times you'll see, well, if you're this age, we expect your testosterone to be this. If you're this age, we expect it to be that. Generally, most of the time, the lab normal cuts off around 75. Optimal for ladies, I will always loosely say between 100 and 200. We've got studies upwards of 400, a testosterone level of 400 in a gal that is showing really no negative downsides. So do I have gals who feel great at 250, 300? 1,000%. Do I have gals who their sweet spot's 75 to 100? Absolutely.
Right. Yeah, that is a really great point. It's really the focus is on where do you feel your best. And
Correct.
we take the, so if you come to us and you're like, I have a level of 50 and I feel amazing, it's like, great, then you're good. You don't need to be on it. So that's the point, is where do you feel your best? And then, obviously we check levels to make sure you're within some sort of normal range, but it can vary.
And I always like to make the point too, and a lot of times people will hit a level and they'll say, well, I feel good. What does 50 more points higher feel like? You've also got to have the understanding of too high can cause some of the same symptoms as too low. Like for me personally, yes, also on testosterone, I share a very similar story to Meredith. But you get my levels above 150, 175, and I don't feel near as great as I would under 150. So it's different for everybody. You have to find what works for each individual and what they're focused on. Is it energy? Is it libido? Is it X? Is it Y? What are their goals?
Okay, now let's talk about, so Kimberly's asking about pellets. I didn't metabolize the testosterone properly, lost hair because of it. Is there something other than pellets that I'm also allergic to all the things shell, iodine, and gluten sensitive. So a lot of things she can't take.
Okay.
So, and you have experience with everything, Melissa.
Yep. So my
all
answer
of them.
is yes. I mean, there's creams, there's a variety of orals, there's injections, there's pellets. So there's options. And a lot of times I'll get the question, well, what's the best form? The best form is whatever works for you. If you were losing hair on testosterone, your dosing was probably too high. It's a side effect that can happen, but I usually only see it when dosing gets too high.
Mm-hmm. Okay.
I'm a gal who started with, I've tried almost all of them. Orals. I did not do creams. I did injections. I feel better with injections than it's more of a high, I'll call it. Like I definitely, my libido is higher than it would be. My energy is higher than it would be, but tend to have more side effects on injections. And I'm a terrible patient. Even though I know testosterone makes me feel better, life gets in the way. I'll forget a dose. My OCD says, well, if I forgot it and Sunday is my day and I remembered on Tuesday, I can't throw off the schedule and I'll just wait till next Sunday. So I ended up putting myself on a roller coaster and I do pellets for myself personally. But I'm also a very conservative practitioner who says less is more. I would rather avoid all of the side effects and still feel good and have more consistent. So a lot of pellet providers will say, well, this can be done every 3 to 6 months. I do my pellets, I just do a lower dose to keep myself more consistent and in that range where I feel good every 8 weeks. So just like you heard Meredith say, for some gals, a once a week testosterone is fantastic. Some gals, it's twice a week. We may even have to talk about a microdosing 3 times a week. There's orals that can be done once a day, twice a day. Creams can be done once a day, twice a day. It's all about finding that steady state of what works for you.
Yeah. Yep. I agree with that. I tried creams myself and I felt like I think that's an easy place for people to start if they're a little bit scared. Because it's just an
It's
easy
just steady. It's going to go
affirmation.
away. Yep.
But I found it kind of like a little bit annoying, sticky, gooey, and then you have to
Hmm.
do it more often. But it is a good place to start if you're scared.
Yep.
Okay, side effects to be on the lookout. So Sarah's going to start injections.
Meredith, have you had any side effects that you've had to manage through?
I definitely have way more facial hair. I'm not gonna lie and be like, there's no, of course, everything's been roses. But also, I'm 44. There
Yep.
was facial hair prior to
Or,
starting the testosterone, but it's definitely darker, right? I have very dark hair, so
yep.
I'm gonna have. I mean, I have to shave my armpits every day. Okay, I don't know how much information you want, but I have to do it every day. So I started, I got one of those. I got Instagram sucked in on a,
Dermaplaner.
yep. And
Yep.
it's a really good one. And I bought a nice quality one because I knew it was something that I was going to have to do probably once a week. And it's been great. In terms of other negative side effects, no, I haven't really had any when it
Awesome.
comes to, and I inject like, right. Like
Yep.
I'm an injector.
Yep.
Like my
Have you lowered your dose to try to get less hair and then you just don't feel as good? Is that
No, I'm not touching my dose. I would
okay?
much rather have sex every day and have a little facial hair.
And that's the balance where most gals are just like, okay, well, am I willing to deal with this because I feel amazing? Or do I want to sacrifice feeling amazing because I have 3 chin hairs that I have to pluck
He
every week
doesn't
and
mind
pay
my
attention
mustache.
to?
I think we're
Right.
good. So,
If I have to pick, if he's got to pick between sex and a mustache,
yeah.
he doesn't care. Honey, use my razor if you need to shave the mustache. Let's keep
Yeah,
having sex.
he's not
I can tell you,
complaining.
maybe I need to up my dose. I do not have sex every day, but but I'm sorry, Riley, you can plug your
Oh,
ears, but
please. I'm here.
I notice though when I do take, if I ever get too much, my side effect is I get like a little pimples along my
The
eyebrow line.
hairline.
So
Yep.
once I realize see a couple, then I'll back
Back
my
down a
dose
little bit.
down a little bit, which
Cystic,
is it.
cystic acne, facial hair are two that I will talk about for sure. And again, if you've got them, it could be because dosing is too high, but just like Meredith said, it becomes the balance of I feel great. Is it manageable to me? Fine. The other thing I'll talk about with gals is increase in clitoral size, clitoral megally. I will tell you in my almost 15-year career, I've had one gal complain about it. We dropped her testosterone dose. She came back 8 weeks later and was like, Melissa, whatever you did, don't do it again because I cannot orgasm. I was like, oh, she's like, my clit is smaller than it was, but now I can orgasm.
Hmm.
So I usually tell gals, yes, you may get, and I'll describe it as like a post intercourse swelling. That's kind of where, if you're noticing a drastic increase in clitoral size, then we have to have a different conversation, but it also increases sensation. So most of us gals who are post kids, we're like, yep, set the timer for 45 minutes. If I haven't had an orgasm in that time, I'm just frustrated, and, we're going to give up. Now we're like, oh yeah, I can have a quickie again. This is fantastic.
Mm.
Voice changes are another one. It has the potential to increase muscle mass, and not in a bulky sort of way, but the vocal cords are a muscle. So sometimes you'll feel like a scratchy throat, things like that. Or people will say, I can't hit the octave when I sing in the car by myself or in the shower. Um, I don't sing anyway, so it's not one that I've ever noticed or care about. And then on a different level, from a laboratory standpoint, we're always watching hemoglobin and hematocrit. Far more a bigger problem in men than women. Hydration plays a role in that. Outside of that, yes, I'll watch liver enzymes. Yes, I'll watch lipids, but testosterone should have a positive effect on all of those as opposed to a negative.
Well, that's a great way to go into someone is asking, can you remind us of the benefits of testosterone? So why would someone take it? What would should you feel if you're
So let's go to the first, how you feel, besides the actual health benefits. Energy, focus, concentration, libido, ability to orgasm, muscle tone, weight loss, joint pain, natural anti-inflammatory, mood, anxiety, depression, irritability. So all of you ladies who, and most of the time, by the time I get a gal, she's been to 2 or 3 other places, feels like she's crazy, knows she doesn't feel like herself. And we're irrational rationalizers. It's something you hear me, I say a lot. Of course I'm tired. I'm raising teenagers. Of course I'm tired. I've got a successful career. Yes, I've got a husband. Well, and because I'm tired, I'm not sleeping as well. Because I'm not sleeping as well, why would I want to have sex? And then like we make excuses for all the reasons because we can find a legitimate cause for why we're tired, why we don't want to have sex. I remember asking a gal once if she had brain fog, and she was like mom brain, and I was like, yeah, sure. She goes like, no. She goes, oh wait, well, what do you mean? I go like, do you walk into the pantry and know you're in there to make dinner, but you can have no clue on what you were going to make? So you go into the laundry room and then you remember what you were making for dinner. And she was like, oh, every day. Yeah, that's part of testosterone.
Mhm.
So ladies, you're not crazy. It's not in your head. Let's high level it. Testosterone starts to decline in most of us by the time we hit 30. Pregnancies can impact testosterone levels 20 to 30%. They may not recover. Birth control, oral birth control pills also affect testosterone levels to the point that they may never recover. So there's things that we're on top of all the things like Meredith talks about, like the green laundry. I mean, the laundry detergents can play an impact and decrease our levels. The microplastics, all of the stuff in our environment has a huge impact as well. So it's not just a perimenopause thing. Most of the time it's happening, but it's also coinciding with potentially being married, having kids, having a career. And so
Yeah.
it's easy to think it's that. Your true other health benefits, well, you decrease your risk of dying from anything. Typically, you're going to get lipid improvements. Ladies, you can't make sex hormones when your cortisol is high. So it becomes a balance to your stress hormone, which is cortisol. You
I actually
decrease.
just posted something about that yesterday, which I found fascinating. It said
You
something like
can't.
you can't, if you're making stress hormones, you can't make sex
Yep.
hormones. So
Yep.
that's true. So if you're saying if you're overstressed constantly, your
It's going
sex
to steal your testosterone.
hormone.
So it's why, like when Meredith noticed a drop, well, it sounds like they're ready to launch a huge new part to their business. So absolutely, I would anticipate a drop. I also will this time of year where, it's easy to think, oh, it's the most wonderful time of the year. As females, we're stressed out. There's gift giving, there's parties, there's a lot to do. Time and time again, come January, February, I will see gals' testosterone levels plummet. And I either have to know to prep for it or we're going to catch it on the backside just because the holidays are a stressful time. Surgeries are stressful, deaths are stressful, job changes are stressful. And those are all things that can mess with our hormone levels, either naturally or if we're supplementing as well. Testosterone decreases your risk of breast cancer. It decreases your risk of developing any and all types of cancers. So beyond I feel great and I feel like me again and I get to be a human, you're also doing your body a lot of great things.
So I will interject with that one. I had to get 3 mammograms last year because I have fibrocystic breast
Cystic breast.
disease. And so the first one was before I started.
Mm-hmm.
The second one, after I had started, the cyst had shrunk. The third one, I was cleared to go back to annuals.
Awesome.
And I had no idea
Amazing.
that the
Yeah.
testosterone played any role in it. But I was like, holy crap, what do you mean they got smaller? Like the cysts got smaller. And
Yeah, they
so
shrink.
I back to which is great to be back to one mammogram a year because
Right.
three is a lot. And two
Um,
ultrasounds, but it was good to hear. Now I do have now, and you mentioned this one too, and I'm just sharing.
yep.
I have always had high cholesterol.
Mhm.
Apparently it's genetic,
Yep.
because I eat right, I exercise. My muscle mass has absolutely increased since being on testosterone. Um, and I have lost some weight and but my cholesterol is up over 200. And so that was something that they told me that we're going to just continue to keep an eye on. The provider, was like, we're
Yep.
going to continue to keep an eye on it. But I've struggled with that since I remember I was in high school and I gave blood at like a blood drive and they flagged my results. And I think I was 18
You're like,
and I was
I'm the healthiest I'm gonna be.
like at 205 and I was like, now I definitely was probably came from McDonald's, okay, if we're being honest. But so that's one that I have struggled with. But I also wouldn't say that being on the testosterone has increased it. It's something I personally have always struggled with.
Right.
So it's something we always watch.
Yeah.
Hmm. Yep.
And
Is
as
200
Meredith,
a
as
high
you get it,
level that you'd be worried about
for
too?
me,
Yeah.
from a cholesterol standpoint, I think that we got into this kind of fear state where, I mean, once upon a time, a normal LDL was 130 and under. I'm okay to let my people still run there. And it's also knowing that in perimenopause, so same age as Meredith, I'll be 45 next year. Um, and estrogen plays a big role in lipid or in your lipid metabolism. So it's understanding also where you're at in perimenopause to know, okay, I'm at a point where I need some estrogen support so that my lipids don't start to go through the roof. At 205, no, she'd have to honestly, and again, there's a lot of other factors there. Triglycerides play a big role into that. What's your HDL look like? Your ApoLipo-B, all of those. But at 205, I'd be like, yep, I'll see you again in a year. But when for Meredith, if that starts creeping up, now my first thought is not going to be testosterone. It's going to be, oh, are we at a point where estrogen levels are shifting? And do I need to support her from an estrogen standpoint?
I'll ask that question next time.
Great to know.
Yeah.
Okay, so let's get some more questions. Misty is taking testosterone, normal range, but she feels like she needs to increase it, and you do have a follow-up in a couple of weeks. I would just say,
Tell them that.
tell
Hey, I
them
feel
that.
better, but I feel like there's room to go.
Yeah. And hopefully you don't get any pushback there because it's fine. You don't want to like do every dosage changes on your own, right, Melissa? But if
Right.
you're talking to your provider and they say yes, then that's totally fine.
Correct. And
And
here's what
then,
I tell everybody. If you hit that, if you go up and you're like, nope, I guess I did feel better where I was. Now you know.
yeah, exactly. And with injections or creams, it's very easy to make those changes.
Correct. And the big thing I caution everybody is just because you tried pellets or you tried a cream and you didn't notice an improvement, please don't write off hormone replacement, testosterone, because it means that either A, we didn't find the dose or the formulation that's best for you.
Right. Claire's asking about Pennsylvania because now Joy can't prescribe in there. This is what we're talking about with it being a controlled substance and there being different state laws, and it's very complicated and very annoying and frustrating. So that's why we are working to try to get it to be non-controlled so that people can have more access. So at this point, you just have to find a local doctor that will prescribe it to you. But hopefully that changes next year.
What a bummer.
It is
Yeah.
a bummer. It's so annoying. Same for Connecticut too. Yep. DHEA, that's kind of an interesting one. DHEA and pregnenolone can possibly, they're precursors. Can you explain those?
Yep. So in the whole steroidogenic pathway, it all starts with cholesterol, which is why when we lower cholesterol too much, you can actually drop your hormone levels and increase cortisol and decrease testosterone, etc. So that whole pathway starts with cholesterol. You've got progesterone, estrogen, testosterone, like it flows through all of that. If I had it easy, I would screen share, but all good. I can maybe share it to Katie and Katie can put it on Instagram so everybody can see it. But so in that whole pathway, before you get to testosterone, DHEA sits just above testosterone. So it's a supporter to testosterone. And yes, it can break into testosterone. Typically, though, it generally doesn't do as well as replacing testosterone. So I was on DHEA before I was still in denial that my testosterone was a problem, or before it symptomatically was a problem to me. And it raised my levels a little bit and I felt better, but and that was probably in my late 30s, mid to late 30s. By the time I hit roughly 38, 40, it wasn't doing enough to keep up with the symptoms.
Okay.
Would raise my testosterone levels, but not enough to symptomatically improve things.
Yeah, I take a little bit too, but
Yeah, it's still a great supplement. The dosing is different depending on if you're taking it supportively or if you're trying to increase testosterone levels.
yeah. Okay, Deborah is currently on Joy, testosterone since April, also progesterone. So you have a couple weeks of low energy and not feeling 100%. What are the signs? We talked about the signs of too high or too low. So she did start split dosing, which is good. Her newest RX is that it's an MCT oil. So there's different, so testosterone cypionate comes in different carrier oils, basically. So
Yep.
it's
Just a delivery system.
grapeseed, MCT,
Cotton oil.
I don't know what else, but it's not really, that doesn't have shouldn't have too much an
Should
effect.
not. Nope. Usually the only thing I see with an issue with those is if you have an issue with one of the oils, you'll get almost like a hive at an injection site.
Hmm. And it's just
Time and
different
time again.
pharmacies have different.
Just different pharmacies have a different delivery system. Yep.
And then so she also just asked about progesterone. Should she be cycling that or taking them nightly, which is
The loaded question. We could probably spend a whole hour talking about progesterone. Here's what I'm going to tell you. Here's going to be my easy answer to that one is that's definitely a detailed conversation with one of the clinicians. Because for some people, cycling is better. For others, it's nightly. Others, it's 3 times a week. I've had women who take 4 different doses depending on which week they're at in their cycle. So it definitely requires some experimentation with some hand holding at the same time.
yeah. And Deborah, hopefully you have another appointment soon, but if you need, just email us, and we can make sure you get that help. You can also ask your health coach those things too. Okay. Misty just started. Current level is 13. Do you start low and then reassess and move up? You always start low. We always start you low, and you're on a low dose anyway. What's interesting, can you tell, I've heard this. Is this true that the dose we put you on for HRT is lot smaller than birth control dose? Or is that true or not true?
There's no testosterone in birth control.
Yeah, no, totally. But I mean, in terms of like
Like from
just
an
hormones,
estrogen
estrogen,
standpoint,
progesterone. Yeah.
um, this is trying to compare a little bit a red apple to a green apple
Okay.
because we're also talking a more natural versus a synthetic version.
Okay.
So yes, but
Just throw the
they're not,
throw the
yeah,
question out.
not fair to
Totally
compare.
fine. But the point is, we're always going to have you on a low dose, but it takes a little bit to kick in, right? I mean, you'll probably feel something right away, but you want to give it several weeks at
Yeah.
least, right?
I tell everybody 3 to 6 months, and generally it can take up to a year to really get stable. And just like you heard Meredith say, like, oop, my level dropped a little bit. I was having breakthrough symptoms. Those things may not always be there right out of the gate.
Yeah.
No, it
Um,
took the first 3 months. I really started to notice a difference in my energy.
mhm.
And I can tell you within the first 3 months, I did not know what a libido was until I had taken the testosterone. And then I was like, wait a minute,
What's this?
what is happening? And I mean, for a while, my husband would call me the body snatcher because I'd be grabbing him out of rooms and like it was intense in the beginning. And then, I can tell you that probably that dip that I had, it was a hugely stressful situation in the house and with the businesses and everything. And so I never even put that together that my levels would be dropping.
Yep.
But yeah, I mean, for having been on it for over, just over a year now, I definitely feel the most balanced. One of the things that I still struggle with, and I have no idea if this has anything to do with testosterone, I still wake up every single day at 4 a.m. and struggle with getting any more sleep.
That's your cortisol. It's balancing your cortisol better.
Yeah, and that's just one of the things that I have struggled with for so long, and I just can't seem to get a handle on it. And we did try progesterone. I did not like the side effects of it, so I had stopped taking it. They upped it on me. I did that for a little bit, but that caused a lot of grogginess for me and feeling very like blasé for hours after waking up. So I was like, if I don't need it, do I have to take it? And, so we're having that conversation sort of on and off in appointments.
And you, Meredith, you may be someone who needs far less. Like for me, I don't really do great if you give me more than 25 milligrams of progesterone, and I
Mm.
can't take it every day. Like I'm a 12 and a half to 25 milligrammer 3 to 5 times a week. If you gave me 100 milligrams, I would just be like non-functional. I would be a bloated tick.
And is
But it
25
also,
enough to protect the uterus?
I don't have a uterus, so I don't have to worry about
Oh,
protecting my uterus.
okay.
yeah, me either.
Okay.
Yeah.
So we get to have a little more fun with our dosing.
Yeah. Oh, good. Well, lucky you. Okay.
But and
Yeah,
honestly,
no
right?
uterus. But yeah, I do know that they did talk quite a bit about that in the appointment about what
Yeah,
the progesterone does. But
does.
for me, I would pay, the amount of money I would pay for some solid 8 hours of sleep, like it just eludes me. So that is something that we're still trying to figure out and search for answers on.
Answer.
But overall, it's been a big improvement.
Yeah.
And also, as Meredith is talking libido too, I tell a lot of people, yes, my libido in my relationship is better, but it's all the little stuff that leads up to the libido that for me is, I'm not going to say far more important, but just as important as the actual intimacy of sex is it's the butt grab when you walk past them in the kitchen. It's all the flirting that you didn't realize had disappeared from your relationship that now is back. So let's say there is a week where you're like, okay, there's not a chance that I'm going to get to utilize the libido I have, but I'm still being intimate with my spouse and we're still connecting on a level that wasn't there before.
Oh, that's really
Yeah.
nice. I like that.
Yeah, I agree. I agree. I think we talked a lot of, and so we've been in couples therapy for 7 months now. And we've spoken with our therapist about the fact that me going on HRT has absolutely been one of the things that saved our marriage.
Yeah.
On top of that, yeah, we lucked out and just we have a great therapist, but it has been given me the ability to think way more rationally and logically when something happens where I would fly off
Yep.
and just be enraged.
Yeah.
And now it's so crazy to think that I can sit there and, we can have a conversation about something that would have just thrown me off the deep
Yep.
end
Yep.
previously. And now I'm like, well, let's talk about it. And sometimes my husband looks at me and he's like, you don't want to yell at all? And I'm like, no, I don't really want to yell at all.
Good.
And
I
it's,
can if you really need me to, but
yeah,
no.
I mean, and then I'll
Will
give him
that
some
turn you on?
logical,
I don't
yeah, I'll
know.
give him some logical response. And he's like, he'll ask, are you joking? And I'm like, no, I'm not. But for so many years, it was just, you
Yep.
know, like level 100.
Yep.
Yeah,
And I don't remember the statistic, but
relatable.
the statistic of women who file for divorce in the perimenopausal state is so high. And testosterone does, it plays a role in executive functioning and how your brain thinks.
Yeah.
We were right there. And we've been very public about this, but we were having real conversations about, we call it division of assets, AKA division of debt. Because it was like, I don't know that we
I
have
don't
that
have
many
any
assets,
assets right now,
but we
they're
have a
all
lot of
wrapped up
debt.
in a business.
Yeah. And I told him I was gonna assume zero. So I was like, good luck, buddy. It's all yours. But no, we've had real conversations about that. And I can tell you that if we hadn't met, if I hadn't had this conversation, if I hadn't found some help, he wouldn't be sitting behind me.
Oh,
We
wow.
would have been done because this past year would have eaten us up and spit us out. But
Wow.
it's given me just I can tell you that I have a different perspective. I can see things more clearly. It's it's a game changer.
Yep.
That is incredible. Can you stay on testosterone for lots of years? Is there any dangers?
I don't know about Meredith, but you'll pry it from my cold dead hands. I'll go to the grave with it.
Yeah, that's how I feel now. It's like there's no going back. Like, because it's almost like you open your eyes and you can see things in like it's like watching black and white TV to color TV.
Mm.
And so you open your eyes and you're like, holy shit, this
Yeah.
is, I mean, it's what is it, Technicolor? What if how now I'm aging myself, obviously, but
Love it.
it's or what would the kids say? 5K, 4K? I don't know.
8K,
But
wherever we're up to now.
8K, yeah, whatever we're up to. But it's very different because it gives you just I've said to my husband, I was like, this is what men feel like? Like, is this what men feel like? Like they feel like, well, of course I can do this. Who's going to
Right.
tell me no? You know,
Right.
it gives you this, like you have these feelings of
Confidence.
like, oh, I can do all of these things. And you feel like you can. You have energy, you have more confidence, you have these rational thoughts flowing through your head. And for years, they were just stolen from me because my hormones were so out of whack.
Wow, that's powerful. Really
I'm a
is.
better mom because of it as
Absolutely.
well. Like, I don't fly off, like, you get home, busy job. Okay, well, I got to get you dinner. Somebody's got to be here. Somebody else has got to be there. You're just like, okay, we'll get there. It's all going to happen.
Yep.
Not irritable, not yelling at the kids. Like, for me too, like, besides being able, the best version of me and being a better wife, my kids don't have to grow up with me yelling, irritable, walking around eggshells on mom. Like, they're going to leave my house knowing, God, mom really loved me and she loved me hard.
I agree.
So important.
I mean, I don't know if my husband would, I think he would say the same, but I think that I am substantially a better wife being on HRT. He's raising his hand. I mean,
We
just
got confirmation.
it just and
Yeah,
just because I can. I feel like I have the tools to do it now.
right.
Uh,
And it's so important. And I'm also gonna and I would sit here and say the same thing on a live or to my audience or whatever. I would tell everybody to go to couples counseling, even if you don't see an issue, because communication is key, especially at this age in our lives and depending on how long you've been married. I mean, we just celebrated 21 years.
That's awesome.
So, you know, like there are
Congrats.
so many things that play a role. And to the one asshole doctor who told me to get a hobby, he wasn't wrong. Then because my therapist recommended it, and when I took her up on it, the weirdest thing happened. My husband and I golf together now, and it's actually been phenomenal.
Yep.
So having a hobby is something that I never thought I could enjoy, and I have one now, and I golf with him, and it's been really good.
Well, that's beautiful. So that was actually good advice in a
I
bad way.
can't,
I
I can't
didn't think
hear it
about it
when
at the
your
time, but
hormones were
yeah.
balanced. Not what that wasn't the
Yes,
answer
No,
to.
it was not. But as my therapist said, maybe it would be a good time now for you guys to find a way to connect that isn't around a business. And that
right.
made sense.
And around the house.
And
Oh
around the
God,
house. Yep.
I need that too. Okay, can I ask, does testosterone, when you test it, matter? Because we know that estrogen and progesterone fluctuate. Does testosterone fluctuate?
Yes. Always going to be higher in the morning, always going to be higher post workout. Yes, you'll get some minor fluctuations depending on where you're at in your cycle, but not enough for me, or in my opinion, to drastically change when I would draw a lap. Like, I tend to think about things practically. I I still have both ovaries, which is where testosterone is primarily being produced. Not that I'm producing any. I don't have a uterus. So if you asked me when my cycle was, I'd be like, I couldn't track it. And there's plenty of gals who have PCOS, who have irregular cycles anyways, who don't have a clue when their cycle is. So just test it.
Yeah. Yep.
Yeah, that's a
Agreed.
tough
We
one when
don't
they ask
come post
somebody.
gym, but other than that, yeah,
So
Yeah.
for somebody who's on it like I am, or anybody that's in the Zoom that's on it, and we have to go for our 3 month
your labs.
labs,
Yep.
should we avoid going the day after we've injected?
Yes.
Okay.
So I always, if you're a once a week injector, I like days somewhere between days 6 and 8. So if you were a Sunday injector before, and when you were doing once a week, I would want to do your labs on more than likely a Monday and have you hold your Sunday dose. or worst case scenario, a Friday, but I know Friday is still going to be a little bit higher than it is when you get to Sunday. For the split dosers who are doing twice a week, if you're Sunday, Thursday, I would just want to do labs on you Thursday morning before you do your next injection, because that's where you're living all the time.
Okay, then that's what I'm going to do next time because I haven't really been paying attention to that, but that sounds smart. So
Yeah.
I'm going to go get my next round on a Thursday and not take my shot until I get home.
And here's why. Let's say you did your injection on Sunday, you did labs on Tuesday afternoon, and you came back at 1:45. Well, you're going to be lower than that on Thursday, but somebody's going to say, well, this level looks okay. So you may be less likely to get the dosing change that you need, but maybe you're really running at 108 and had a 40-point drop.
Yeah, that's okay. That makes a lot of sense. And I always go first thing anyway because most of our labs are fasting.
Yeah.
Yeah,
So,
for sure.
yeah.
Does free testosterone matter when you're talking about levels?
Yes. More, I'm going to say more so in men, That's not necessarily accurate, but we haven't established in men where we know the optimal total to free ratio should be 2%. We think that's what we should be aiming for in females, but there hasn't been enough research to say, yes, a free testosterone to total testosterone ratio of 2% is ideal. I find that the free tends to matter more in guys than it does for gals. And I don't know if that's because we tend to pay more attention to how we feel. Like it's easy for me to tell you, yes, my focus has dropped about 10 days ago or whatever that is. Guys are just like, I don't know.
Yeah.
Yeah.
So,
And for people that don't really understand what that is, free is like what your body has more available to use, right?
correct. There's free, there's albumin bound, there's bound, SHBG can bind up some. So free is just what is actually circulating in your body to turn on the processes and make you feel better. It's what's actually available for use.
And is there ways to raise your free besides just
It,
taking testosterone?
yes. So it also depends though, like, is your SHBG high? What are some of your others what do some of your other markers look like that could be impacting your free?
Yeah.
That's one where you can't look at it in a tunnel because it's definitely a wider scope, bigger picture.
Yep. Yep. That makes sense. Okay. Do we have any other questions we need to answer before we let everyone go on the weekend? Why does hormonal changes cause headaches? That's more of a bigger question, but is that
Yeah,
what the answer?
that can be testosterone, that can be estrogen, that could be heavily progesterone, how those are all in balance with each other. And I know people get sick of hearing about cortisol, but cortisol is the great masquerader. I mean, cortisol can look like everything. So
Yeah.
diet can matter, how much caffeine, all your endocrine disruptors.
Yep. Yep. And then the impact of high SHBG, Holly, is that it makes your free, it binds up your testosterone that
Yeah,
you can
you
use.
have less free available.
Yeah. And I've heard that like things that we do can permanently impact like SHBG, like being on the pill will raise your SHBG.
Yep. And the
Permanently, I
question
even
is
heard
potentially permanently. Yep.
antibiotics, other things, stress, obviously all that stuff impacts that.
Correct.
And there's some supplements that are good too for helping with testosterone. I mean, you need a good vitamin D level, right?
Absolutely.
Yep. And then anything to lower your stress helps.
Right.
Like ashwagandha and that kind of stuff.
But even simple things like when you go to bed, are you consistent with bedtimes and awake times? Are you an over exerciser? Do you drink enough water? Do you drink too much caffeine? Do you not have enough protein? Do you drink too much alcohol? Because those are all things that impact cortisol levels, and cortisol will definitely steal testosterone.
Hmm.
I think I had saw a question come up that if you drop cortisol levels, can you raise your testosterone levels? Sometimes, yes. Um, Usually I only in one case have I ever seen it be enough that where I would have prescribed testosterone. She did the work on her cortisol. It raised dramatically to the point that she didn't have any testosterone symptoms left.
Right.
But yes, so if you lower your cortisol level, you may see your testosterone level jump up that 20, 30 points again, or whatever it may be.
Great.
But there are people out there that would have been like me that 20 or 30 points would have made zero
Isn't
difference.
enough. Correct.
because I had none.
At 34, my testosterone level was an 8. I could have done all the cortisol lowering that I had
Right.
wanted to, and it would have never been enough to get me to 150.
Yeah.
Yeah.
Yeah. So I think that's a big thing is everybody is so uniquely different. And that's why I think the labs are just so important to dial in. And it makes you feel better when you sit and have those conversations because they're giving you the real numbers. They're giving you
Right.
the data and they're saying to you,
Here's
this
what
is why you feel like shit.
yes,
Here, here, here,
you're
here.
not crazy.
Okay.
It's not in your head.
Yep. And this is what we're going to do. Here, 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 here.
Right.
And then the hard part is doing it, right? Being the good patient.
Yep. But most of us hit that rock bottom where we know we're not good for ourselves. We're not good for spouses, kids. And we're like, okay, something's got to change or I'm going to lose my mind.
Yep.
Yeah. Wonderful. And then the hematocrit question, how often do you have to give hematic blood if you have high hematocrit? I feel like we don't see high hematocrit in women very often, but maybe
I
Christina might have
almost
some.
never see it in my females. My first question will always be, how hydrated were you? You know, if you're coming in for a fasting lab, I always tell them you've not had 60 ounces of water before you came in for your fasting lab. If all you had was 3 cups of black coffee today before we did labs, I expect that hemoglobin hematocrit to be higher. It just becomes what's the threshold. Anyone who is a tobacco user will naturally have a high hemoglobin and hematocrit. So it's another question to ask.
Okay.
Um, I tend to not knee jerk it if it's been consistently high or it's scary high. But the loose answer there is anywhere from every 3 to 6 months.
Okay.
But
Wonderful.
I've never had to donate blood or do a phlebotomy because I'm on testosterone. If I
Yeah.
do, it's a choice where I'm doing it personally. And I've
My
been
husband does
yes.
a couple blood draws a year because that makes a difference for
If
him.
you, yeah, for the guys, yes, but they're getting far. I mean,
More
like
to
as a
way
female,
more.
when I injected, I was doing 20 milligrams of testosterone roughly a week. The guys are getting 160 to 200 plus milligrams. So
Big
8 to 10
difference.
times the amount of testosterone us gals are getting.
Yeah, I
Wonderful.
think I'm at a split dose of 1.2
Yeah.
and I started at 2. And
Okay.
over a
Yep.
year we've only gone up to 2.4.
Yep.
Yeah.
Very common. Yep.
Beautiful. Well, and then we got some just people saying thank you so much. This was very helpful. So, and I agree, this was awesome. Meredith, thank you for sharing your story. And Melissa, you're just always wonderful to talk to with so much information. So thank you so much. And Riley, good job putting this together.
Ladies.
And thank you guys for having me. I'm pretty much an open book. Will
Meredith, it's
probably
been
give
awesome
more
to meet you.
information than people ask for, but I'm always willing to talk and share about the game changing, life changing
Love it.
care that I've had from Joy.
We have
Wow.
to advocate for each other and ourselves.
Yes.
Yes.
The more we
Yes.
share, the more we share, the less stigma that becomes around it.
Yeah. And I always say your story isn't for you, it's for everybody else who's listening.
Yeah.
And this is a big one because for the longest time, I felt like no one listened to me.
Yeah.
Aw, beautiful. All
Thanks.
right. Thank you guys so much. Have a wonderful weekend. Bye, guys.